Imagine if your bathroom, your private sanctuary, was secretly plotting against your brain. As we speak, thousands of seniors are unknowingly turning everyday habits into life-threatening strokes. Stay tuned, because in the next 10 minutes, I'll expose 4 hidden dangers lurking behind closed doors and show you exactly how to protect yourself or someone you love. Bathrooms are meant to be personal sanctuaries, places where we start and end each day in peace. Yet, for millions of older adults, these familiar spaces have quietly morphed into hidden danger zones. Routine actions as innocent as sitting down, taking a hot shower, or making a midnight dash can send blood pressure on a dizzying roller coaster ride, overwhelming stiffened arteries and dramatically increasing the risk of stroke. Age naturally brings changes. Vessel walls lose elasticity, blood flow becomes less predictable, and the brain's delicate network of capillaries grows ever more vulnerable. When everyday bathroom habits suddenly provoke spikes or plunges in circulation, the consequences can be catastrophic. Consider, for instance, the innocent habit of pushing too hard during a bowel movement. In seconds, blood pressure may skyrocket by 60 or 80 points, placing undue strain on fragile cerebral vessels. Or imagine the comfort of a steaming hot shower. Water temperatures above 100 degrees trigger rapid vasodilation, causing blood pressure to collapse and the heart to race in a frantic effort to recover. Even the swift movement from sitting to standing, so reflexive we scarcely notice, can trigger orthostatic hypotension, leading to momentary blackouts and dangerous falls. And when the urgency of nature calls in the middle of the night, dehydration and medication peaks collide with a sudden change in posture, creating a perfect storm for hypertensive crisis. Today, we'll delve into these 4 life-threatening habits with the help of Patricia, a once vigorous 72-year-old grandmother whose close calls in her own bathroom transformed into powerful lessons. By understanding exactly how these routines stress the aging cardiovascular system, you'll learn simple, doctor-approved strategies to reclaim your confidence and your safety in a place that should never feel dangerous. Habit 1. Straining during bowel movements. When you bear down to push a difficult stool out, you're performing what doctors call the Valsalva maneuver. This involves forcefully exhaling against a closed glottis, essentially holding your breath and tightening your chest and abdominal muscles while trying to expel waste. Almost immediately, the pressure inside your chest and head skyrockets. A typical blood pressure reading of 130/80 mmHg can spike to life-threatening levels, sometimes as high as 200/140 mmHg in just a few seconds. These sudden jumps place immense strain on your heart, which must work overtime to overcome the elevated resistance, and on delicate blood vessels throughout your body. For seniors, this is especially dangerous. As we age, our arteries lose elasticity and become more rigid, much like old garden hoses that crack when twisted. Rigid vessels cannot absorb rapid pressure changes, so when blood pressure surges, microscopic tears can form in vessel walls. These micro tears may not cause immediate symptoms, but they weaken the lining of arteries, creating vulnerabilities where clots can form or outright ruptures can occur. Over time, repeated straining episodes can contribute to atherosclerotic plaque buildup or small bleeds in the brain, cumulatively raising the risk of both ischemic and hemorrhagic strokes. Patricia's experience illustrates how innocuous this habit can feel until it's almost too late. A passionate gardener who spent her retirement tending to roses and tomatoes, she had long battled chronic constipation. Each morning, she would sit on the toilet for 10 to 15 minutes, pushing harder as frustration mounted. One day, after an especially stubborn bout, she suddenly felt her vision blur, heard ringing in her ears, and sensed the world tilting around her. She gripped the toilet seat, heart pounding, until dizziness subsided. Alarmed, her daughter rushed her to the emergency room, where monitoring revealed her blood pressure had peaked at an astonishing 210/145 mmHg during straining. The attending physician warned that if she continued this practice, she faced a high likelihood of a catastrophic stroke. Medical research underscores the gravity of this risk. A 2021 study in the Journal of Geriatric Cardiology found that seniors who frequently strained during bowel movements had a 2.8-fold increase in acute cardiovascular events compared to those who did not. Another 2019 meta-analysis reported that even a single episode of extreme straining can provoke a transient ischemic attack, commonly called a mini-stroke, by momentarily depriving the brain of adequate blood flow. These events serve as dire warnings that everyday bathroom routines can have hidden, severe consequences. So, what can you do? First, prioritize dietary fiber. Soluble fibers, such as psyllium husk or ground flaxseed, absorb water in the gut, softening stools and making them easier to pass. Introduce these fibers slowly, gradually increasing your intake over a few weeks to allow your digestive system to adjust without bloating. Second, hydration is critical. Aim for at least 8 8-ounce glasses of water daily, unless your doctor advises otherwise. Proper hydration keeps stool soft and reduces the temptation to strain. You can also modify posture. Placing a small footstool under your feet while seated on the toilet elevates your knees above hip level, mimicking a natural squat. This position straightens the rectum and aligns the pelvic floor for smoother elimination with less effort. Finally, pay attention to warning signs. Dizziness, visual disturbances, sudden pounding headache, or heart palpitations during straining are red flags. If you experience any of these, stop immediately. Sit back, breathe normally, and consider consulting your healthcare provider. Small changes in your routine can dramatically reduce the risk of turning a private moment into a life-altering event. Habit 2. Scalding hot showers. What happens? When you expose your skin to water hotter than 104 degrees Fahrenheit, 40 degrees Celsius, the heat triggers a rapid and dramatic vasodilation. Your blood vessels expand to release heat. This sudden widening causes blood pressure to plummet. In response, the heart races, trying to maintain adequate flow to vital organs, including the brain. The combination of low systemic pressure and compensatory tachycardia places enormous stress on an aging cardiovascular system that may no longer adapt fluidly to such extremes. Why it matters for seniors. With age, arterial walls naturally stiffen and lose elasticity. A healthy young adult's vessels can absorb rapid pressure changes, but in seniors, this protective shock absorber function diminishes. When blood pressure drops suddenly in the shower, cerebral perfusion, the blood flow that reaches the brain, can fall below safe levels. This transient ischemia can manifest as dizziness, fainting, or even a mini-stroke, transient ischemic attack. Moreover, unanticipated loss of balance in a slippery shower environment dramatically increases the risk of falls, head injuries, and fractures. Patricia's story. Patricia, a retired English teacher with a lifelong love of hot water, routinely cranked her shower to 110 degrees F. To her, the blast of steam was a soothing ritual after early morning gardening. One chilly autumn day, she turned the dial all the way to the right, creating a steam sauna in her small bathroom. Within seconds, her vision blurred and her knees buckled. She collapsed onto her knees in the tub, heart pounding, unable to stand. Paramedics found her semi-conscious. Hospital tests confirmed a transient ischemic attack triggered by extreme vasodilation and abrupt hypotension. Patricia spent 2 nights under observation, grateful that her fall hadn't caused a more severe head injury. Science flash. A 2019 study published in the Journal of Geriatric Cardiology examined 1,200 adults over age 65 and found that those who habitually showered in water above 104 degrees F had a 2.5-fold higher incidence of acute cardiovascular or cerebrovascular events compared to peers who used moderate temperatures. Researchers noted that high-temperature showers induced sudden drops in both systolic and diastolic pressures, often exceeding a 20 to 30 millimeter decline, sufficient to trigger symptoms of cerebral hypoperfusion. Expert tip: keep showers warm, not scalding. Aim for water temperatures at or below 100 degrees Fahrenheit. Use a waterproof shower thermometer to monitor. Install anti-scald valves. Thermostatic mixing valves automatically limit maximum temperature, preventing unexpected spikes. Ensure proper ventilation. Good airflow reduces steam buildup, helping your body regulate temperature without excessive vasodilation. Rise slowly. After bathing, sit on the edge of the tub for 30 seconds to let your blood pressure stabilize before standing. Monitor warning signs. If you experience lightheadedness, palpitations, or blurred vision while showering, immediately reduce water temperature and seek medical advice. By understanding the hidden hazards of excessively hot showers and adopting safer practices, seniors like Patricia can continue to enjoy the comfort of a warm bath without jeopardizing cardiovascular health. Habit 3. Sudden stand-up. What happens? When you move too quickly from sitting to standing, gravity pulls blood into the veins of your legs before your heart and blood vessels can compensate. In a healthy young person, baroreceptors, pressure sensors in your arteries, detect the initial drop in blood pressure and prompt your heart to beat faster and your vessels to constrict, sending blood back to your brain within a fraction of a second. However, if you stand up abruptly, there's a brief window during which your brain receives less oxygenated blood. That split-second reduction in cerebral perfusion can cause lightheadedness, tunnel vision, or even a temporary loss of consciousness. Why it matters for seniors. As we age, baroreceptor sensitivity diminishes and vessel elasticity decreases. Up to 30% of people over 70 experience orthostatic hypotension, a drop of at least 20 mHg in systolic or 10 mHg in diastolic pressure within 3 minutes of standing. Without a prompt autonomic response, the brain can be starved of oxygen, causing syncope, fainting. In a bathroom setting where hard surfaces abound and help may be far away, a blackout can quickly lead to serious head trauma, hip fractures, or a broken wrist. Even if no bones break, the shock of a fall can erode confidence, leading seniors to restrict activities and lose independence. Patricia's story. Patricia's devotion to punctuality nearly cost her life. One Sunday morning, eager not to miss church, she stood up abruptly after sitting on the toilet for several minutes. Without warning, her vision tunneled, her legs buckled, and she crashed backward onto the porcelain tank with a sickening crack. Neighbors heard the impact and rushed in. In the emergency room, nurses noted her blood pressure plummeted from 135/75 while seated to 85/55 just seconds after rising. A CT scan revealed a non-displaced skull fracture. Fortunately, no brain hemorrhage. Still, doctors warned that another fall might not end so well. The combination of orthostatic hypotension and the unforgiving bathroom environment had turned a routine action into a near-fatal incident. Expert tip: to guard against sudden stand-up syncope, follow this 3-step safety method. Sit still, 30 seconds. After finishing on the toilet, remain seated with your back straight for at least half a minute to let blood vessels adjust. Edge forward, 15 seconds. Move slowly to the edge of the seat, keeping your knees higher than your hips if possible, and pause for another 15 seconds. Stand with support. Place your hand firmly on a grab bar or countertop and rise slowly over a full 10-second count. By pacing each phase, you give your cardiovascular system the time it needs to reroute blood, preventing dangerous drops in pressure and potential falls. Habit 4. Unprepared midnight rush. What happens? During sleep, our bodies naturally lose fluids through breathing and perspiration, causing mild dehydration by morning or even by the middle of the night. For seniors taking diuretic medications or blood pressure pills, fluid loss is compounded. Diuretics force the kidneys to expel water, while antihypertensives can reach peak concentration in the bloodstream during nighttime hours. The result is blood that becomes thicker and more viscous, increasing systemic resistance. When you abruptly bolt upright in a dark room, gravity instantly pulls this heavier blood into your lower extremities. Meanwhile, baroreceptors and cardiovascular reflexes are sluggish, particularly in older adults, so the brain briefly endures a critical drop in perfusion. This combination of dehydration, medication-induced fluid shifts, and sudden movement forms a perfect storm for dangerous blood pressure swings, hypertensive crises, and stroke. Why it matters for seniors. Studies indicate that the period between midnight and 6 a.m. is fraught with cardiovascular peril. Unprepared bathroom trips during these hours carry a 400% higher risk of stroke compared to daytime visits. Older arteries lack the rapid adaptability of younger vessels. They cannot swiftly constrict to maintain cerebral blood flow when pressure plunges. Simultaneously, a dehydrated system forces the heart to pump thicker blood, risking spikes in systolic pressure that can rupture fragile cerebral capillaries. Even a brief period of reduced oxygen delivery, mere seconds, can trigger a hypertensive emergency or transient ischemic attack. In the confined, slick environment of a hallway or bathroom at night, the danger magnifies. A sudden blackout or dizzy spell can lead to catastrophic falls, head trauma, and delayed medical intervention. Patricia's story. At 2 a.m. on a winter Tuesday, Patricia awoke with her habitual urge. Half asleep and groggy, she sat up and swung her legs over the mattress without pausing. Immediately, her head spun, her vision tunneled, and she sank to the floor, shattering the silence with a muffled thud. Alone, she lay dizzy and disoriented, clutching her chest. A quick glance at her reading glasses, resting bedside table, revealed a small water bottle, untouched. She managed to raise her trembling hand and dial 911. Paramedics arrived within 8 minutes, finding her blood pressure at a perilous 210/120 millimeters mercury. They administered intravenous fluids and antihypertensives, crediting her clear-headed decision to call for help with saving her life. Her cardiologist later explained that the combination of overnight dehydration, peaking diuretic effect, and abrupt posture change had created a hypertensive crisis mere moments from a full-blown stroke. Science flash. A 2020 study published in the American Journal of Hypertension examined 800 seniors on nighttime diuretics and found that those who made unprepared nocturnal bathroom trips had a 4-fold increase in stroke incidence compared to peers who followed a hydration and movement protocol. Researchers measured significant variability in nocturnal blood pressures. Some readings soared above 200 millimeters systolic immediately following standing up, confirming the deadly link between dehydration, medication peaks, and posture shifts.
Clear lesson and takeaway. Your bathroom should be a place of calm and routine, not a hidden battleground for your cardiovascular health. Today, we've uncovered 4 surprisingly common habits: straining during bowel movements, indulging in scalding hot showers, standing up too quickly, and rushing to the loo in the dead of night that can send your blood pressure and heart rate on a dangerous yo-yo ride. Each habit alone poses a threat, but together they compound the risk of stroke and other acute events. The good news? You have the power to turn the tide. By adopting a more ergonomic posture on the toilet, think gentle squatting with a footstool, you minimize the need to strain. Keeping shower water at or below 100 degrees F prevents sudden vasodilation and the dizzying drops in blood pressure that follow. Implementing a simple 3-step stand-up routine, sit still, edge forward, then rise slowly while holding a stable support, gives your cardiovascular system the time to adjust. And transforming the midnight dash into a deliberate ritual, hydrating before you move, illuminating the path, and pausing at the bedside can cut nighttime stroke risk dramatically. Together, these 4 small adjustments can reduce your likelihood of experiencing a stroke by as much as 75%. More than that, they restore confidence. No longer will you fear the very place you visit every day. Instead, your bathroom becomes a zone of safety, where intentional, science-backed habits support your independence, preserve your brain health, and empower you to embrace each morning fully awake and secure. Call to action. If today's insights have given you pause, take a moment now to hit the like button. It's a simple click that signals your commitment to your own well-being. Then subscribe and ring the bell so you'll never miss another doctor-endorsed senior health tip. Every video is crafted to give you actionable strategies that fit seamlessly into your daily routine. More importantly, share this video with every older adult in your life, your parents, grandparents, neighbors, or friends. One share could spark a life-saving change. Imagine your mom adjusting her shower temperature, or your neighbor installing a grab bar. Small steps that could prevent a devastating stroke. Finally, drop a comment below and tell us, which of these 4 bathroom habits surprised you the most? Your experience may resonate with someone else watching and inspire them to make healthier choices today. Together, we can build a community of seniors who move confidently through their days, free from the hidden dangers lurking behind closed bathroom doors. Let's protect our health, support one another, and live boldly, starting right here, right now.